experts are warning of a third or even fourth wave of coronavirus infections, confirming fears that, in fact, the virus will still be with us for a very long time ahead. Statistics paint a grim picture about a pandemic out of control. According to the National Department of Health and the NICD, last week's infections and diseases were the highest recorded since March last year. More than 20,000 new cases were reported every 24 hours for about 4 days in a row, and while over 33,000 people have now died since the outbreak. The National Command Council is said to be in high-end meetings about the scourge. Joining us now for more on this and perhaps a way forward is Professor Helen Rees, who's the Executive Director of the Wits Reproductive Health and HIV Institute. The Prof joins us via our video line this morning. Prof Rees, thanks for your time. Thanks for always making time. It's great to chat to you here on the AM Report. So, in some respects, of course, a lot of focus is on our vaccination program. It's seen as the light at the end of this incredibly long tunnel. But now that we're almost halfway through the month, do you think enough has been communicated about how on earth we're going to achieve this incredibly ambitious, vaccination program by the end of the month, which is when we're meant to have inoculated about 40-odd billion people?
Now, I think it's a very good question, and it's one I'm getting from friends and colleagues from all sorts of different walks of life. So I think, speaking as a scientist and somebody who chairs a regulatory authority, I think that we could do better and we must do more. The good news is that I think everyone now knows that we are going to be able to purchase 1 million vaccines followed by 500,000, but we're looking for more vaccines. But we are, of course, competing with the rest of the world in that. But the kinds of questions and the communication that we need to get out there are things around, is the vaccine safe? Has it been developed too quickly? Will there be side effects? Who's going to get it? Why would only one group of people get it first and not other groups of people? So those are the kinds of, if you like, commonly asked questions that I think that we really need to start to explain to the population. And we can do it. We have the information.
Right. In the backdrop is this, emerging concern around a third, sometimes even a fourth wave of the pandemic. At which stage do we start communicating that? But not only that, implementing plans in an effort to deal with it, because if anything, we've learned that what we need to get right with this pandemic is things like timing. When you intervene is incredibly important, sometimes more important than the nature of your intervention.
Well, I think we have to be very realistic about 2021. I think perhaps at some points last year, people were optimistic that 2021 would be much brighter, much better. But it's going to be very tough for the whole year until we really get significant vaccine coverage. And so because of that, we just have to reinforce what we know and be really stringent about implementing them. For example, one of the biggest things that keeps spreading more and more infections are these mass gatherings. So I think we have to look at how do we get the message out to people that the more people that are together, the larger the number of people in a more crowded space without ventilation, often indoors, that is the kind of thing that triggers more and more cases. The messages we have to get out about hand washing, about mask wearing, right up to here all the time. When you're outside or when you're interacting with other people in shops, etc. Those are the messages that we're going to have to keep reinforcing, because those are the measures that we have at the moment while we will be rolling out vaccines.
Yeah. What might be interesting to a lot of people is what I understand to be a new study released by Wits University suggesting that the COVID-19 virus might actually be a seasonal flu too, or at least react to seasons. What could that mean for our response? And I wonder whether many people are surprised by that, because I remember at the initial stages of the pandemic, we were told that, there isn't anything conclusive about whether or not COVID-19 reacts to things like temperature change.
Yes, and unfortunately, we haven't really seen globally that variation that you see with flu, where, the winter months, everyone knows winter months will bring influenza. So we haven't seen that yet. But over time, we might start to see more of a seasonality, but certainly that's not what we're seeing at the moment. And if you think about it, we're in our summer, and we've got the highest numbers of cases that we've had so far. So I think we should, for the moment, assume that this is going to be with us for the whole year. at threatening levels if we do not do something about it. And that's in our hands as individuals. We can't just look to government, and we can't look to doctors and the health service to solve this for us. We all as individuals, and I know people are tired and anxious, we're going to have to take that responsibility individually and within our families.
Right. I mean, you speak about COVID-19 fatigue. It's something we've spoken about so often. But I wonder whether we can spend some time reflecting on what many people consider to be a looming cultural crisis because of something like COVID-19, right? Many people are forced, for instance, to have their final goodbyes to loved ones in such unconventional ways that are completely detached from their own identities. I wonder whether the state can do anything, really, to at the very least communicate that it understands people's identities and the crisis that they face when they have to conduct things like burials. Because I imagine part of the reason why things like funerals are still today super spreader events is because people simply cannot see themselves past ways through which they've been conducting funerals all their lives. You know, are we not at a stage where perhaps we need to give that aspect of our fight against COVID-19 a whole lot more attention?
Absolutely, and you're right. We should anticipate the fatigue and also the challenges. And you've named one that is really emerging as something that we need to think about. This is one of the reasons why you don't only need clinicians and scientists commenting. You need social behavioral scientists. You need traditional leadership who really are in touch with communities and understand culture, because the solutions are not necessarily sort of the solutions that people in ivory towers would find. They're going to be community-based solutions, and we also have to think who are the communicators of these messages. The communicators of these messages should be local leadership who have the respective communities and have positions where they would have the authority to explain why these measures have to be undertaken. The one thing I will say, however, is that because of the challenge, we can't become relaxed about measures around funerals because the threat is just too big. Our hospitals are being overwhelmed, province by province. And if you have a mass gathering at a funeral without all the measures in place to prevent ongoing infection, then that is going to become a reality. But as I say, we need the right people thinking about this and giving the correct message.
Yeah. I wonder, scientifically speaking, if we ever reach a stage where we're not able to conduct funerals in the ways that we even are allowed to now, what that could potentially mean for our fight against the pandemic. I'm thinking even on a practical level now. Many funeral practitioners really starting to sound the alarm about how they're running out of things like coffins. How do we go about dealing with the pandemic, but also having to lay to rest people who've died from the pandemic without exacerbating the situation if we're not able to put them in coffins and put them underground, for instance?
Well, and it's interesting, the funeral organizations have become very vocal, and it's very good that they're doing this now, because we are going to have to think how we're going to manage this. The risk in funerals is twofold. One is there any risk from somebody who's died of COVID from the way that we manage and handle the bodies and the way we say our goodbyes? Is there a risk there? But the other risk, of course, is people getting together, many of whom would have been in the family of that person and therefore possibly already exposed and possibly infectious themselves. So there's twofold there. But again, that is why this response to this pandemic is truly multisectoral. The people who understand funerals are the people who are running the funeral organizations, and there needs to be an urgent discussion with them to see what do they see as the threats and what can we do in anticipation, not waiting for this problem to be upon us.
Yeah. For a country like South Africa, and given our positionality on the continent, the threats really are multifold, aren't they? We've seen the crisis at some of our ports of entry as many people flock into the country for various reasons. I wonder whether then the description of South Africa being the worst affected on the continent is accurate, considering the role that the country plays in some respects in relation to other countries, right? I mean, obviously, if more people are coming into South Africa, the likelihood of a more severe case of COVID-19 is more probable than the countries from which people are leaving. Just in terms of our understanding of the outbreak in South Africa, are we, do you think, accurate in our description of how things are unfolding here?
Well, I think South Africa, and real credit to the people like the NICD and the NHLS who have done this, and the private sector have contributed majorly as well. We have actually been very good at monitoring cases and spread. And we've just seen world-class research that's identified this variant and shown us where this new virus, the variant, has spread to. But the rest of the continent doesn't have such sophisticated surveillance systems. And although we've seen lower numbers, I think we can be pretty sure, for example, that the variant that's in South Africa is in many other African countries, and it will behave in the same way with this increased transmissibility in those settings. So this is one of the reasons why the combined efforts of the African Union, trying to pull all countries together and thinking collectively how we manage this, because there is migrancy, there is movement between countries. And as we know, many countries have far fewer resources than South Africa does. So certainly this has to be a regional effort, which President Ramaphosa is currently leading. But again, we need to continue to think, what does it mean to have a regional effort? Regional purchase of vaccines is one thing that's being proposed, and that would be incredibly important. And the African Union is at the front line of that. But we also need to say, what else does it mean to be in the African Union? How else can that conglomerate really support and help both our monitoring of spread, but also what's happening at borders and problems like that?
Very well. It's a conversation we can never exhaust in one take. So let me thank you for your time. Certainly appreciate your insights this morning live to us there. From Johannesburg, Professor Helen Rees, who's the Executive Director at Wits Reproductive Health and HIV Institute. Thanks very much indeed for your time.